Hi everyone, today let's look at zirconia bridges, specifically zirconia bridges for all-on-4 treatments. Now I've done loads of videos in the past discussing the different materials which are available to build teeth on implants, specifically all-on-4 or full mouth of dental implants. And the general consensus is usually zirconia is the best material. Now, there are certain individual situations where we might not use zirconia, but they are few and far between. You see, zirconia has a lot of strength, and it's generally the material that every dental practice will put on their website saying, we use zirconia teeth. But I want to kind of just show you the different variations of zirconia that are available, and some of the issues that I've had over the years using zirconia. Now, one thing to bear in mind is that we're not just using one material for the full set of teeth. You see, the zirconia is the bit that you can visually see. It's the white part of the teeth. But when somebody comes to us for an all-on-4, typically we're going to put a metal substructure underneath. Now, recently we saw somebody who had had their implants done somewhere and they weren't happy with the bridge that they've got, so we had to redo the bridge. Now, the bridge is made of zirconia, and you can see the two bridges kind of side by side here. And the biggest difference is in the metal substructure. You see, when we say we're going to use a zirconia bridge, it's not a full block of zirconia. It's actually a combination of different materials, and I'll explain why this is important in a second. But you can clearly see here that we've got a metal frame within the zirconia structure, okay? And on the other bridge, we've got basically little metal, it looks like metal discs, but essentially these are little metal inserts which are then glued into the zirconia bridge, okay? So there's far more zirconia on this bridge than there is on a typical bridge that we would make. Now, the reason this is important, we have to kind of understand a little bit about different material properties. So quite often my patients will ask me, hey, can I have zirconia because I know it's the strongest? But when we're talking about strength, what kind of strength are we talking? There is material strength under compression if you squeeze it. There's tensile strength if you pull it apart. The material which is stronger when you're pushing together may not be the strongest when you're pulling apart. And then there's flexure strength, and I've probably said that wrong, and which is basically if you bend the material, one will break before the other. So if you think of zirconia like a ceramic, and your kitchen plates are ceramic, you know that they're strong enough, but if you're going to put a bending force, these things are going to just crack. Whereas if you have a plate made of metal, again, it's strong, but if you put a bending force on it, it's more likely to bend rather than completely fail. And this is the weakness of zirconia. So a couple of years ago, we had a patient and we fitted the final bridge, and it was a zirconia bridge. It was exactly what we see here, the one that we were replacing. So it had these little metal inserts in there, and we tightened it down, and a week later he calls us saying, he's just heard this massive loud crack and he wants us to have a look. He came in and we had a look, and honestly we couldn't see anything until we unscrewed all of the bridge, and the whole thing just fell apart. So this highlights a number of things, okay? Number one, the reason that this happened was that the accuracy in our impressions in all of our molds wasn't perfect, okay? There was a slight discrepancy in the fit of this bridge compared to his actual fit. Now, even though I'd followed all my steps properly, this still crept in this tiny little bit of error. And the reason that it caused this problem was it introduced this flexing stress into the material, and during normal eating this stress was amplified, and suddenly we had what's called a catastrophic failure where the bridge just cracked in half. Now, obviously, he's one of our patients, so we just fixed this for free. But it does highlight the problem of having a full zirconia structure. Now, the other problem is that these little metal inserts are just glued in position. Over time, this glue can weaken, and because these are kind of small inserts, they can just become loose. And it's not really a problem until they all become loose. It's kind of a straightforward fix, but it does mean that the bridge has to go back to the lab. They have to re-cement everything and then and pass it back. And when you re-cement something, again, you've got that tiny element of error, and just a small element, or a small discrepancy in how these things are glued in can cause a discrepancy in the fit, which can potentially lead into this catastrophic failure that we had with our patient. Now, this scenario that I'm describing is kind of rare. I'm sure it's rare because it's only ever happened to 2 of my patients ever, and I've only photographed one of those cases. But it happens frequently enough for me to change and think, look, you know what, if we're providing a really robust solution for our patients, we need to incorporate this metal framework into our zirconia bridges. So what the metal does, it helps reduce a flexing stress in the whole bridge. And as you've got a much bigger surface area to glue to, the metal framework is still glued to the zirconia, but it's much less likely to come apart because of the massive surface area of the contact between the 2 materials. Now, in previous videos, I have discussed that zirconia is also a superior material because of how kind it is to gums. Okay, it's very biocompatible, and this is only if the zirconia is highly polished. If the lab puts a glaze to make it look good, that glaze can actually cause a little bit of inflammation. So there's a really specific way to prepare the zirconia so that it is biocompatible. But you can see, if we've got this metal framework, the biocompatibility doesn't really matter so much because it's not in constant contact. The zirconia isn't in contact with the gum. The metal titanium framework is now in contact with the gum. Now, luckily, titanium is also very biocompatible. That's what all the implants are actually made of. So we don't really have a biocompatibility issue. Not like we used to when we would take off a bridge made with denture teeth and acrylic. Quite often we take that off, and even if the patient's keeping everything really clean, there's redness in the gum, there's a low level of inflammation. So that's what we're trying to actually get away from by using materials like zirconia and titanium in contact with the gum. So you might think that, oh, the zirconia is in contact with your cheeks. Is that an issue? It's not an issue because you've got so much saliva in your mouth. It's protecting the mucosal surfaces. It's only when you've got like a fixed prosthetic, fixed set of teeth in constant contact with the gum, and that's where we can sometimes get these low-grade inflammation issues. So if you're going down this route, I would definitely ask your clinician, you know, what kind of bridge are they going to make? My personal recommendation is the one with the metal framework. Yes, it's a bit more expensive to make, but I just feel it's just got less long-term issues. Quite often, if you go to a dental practice and they do a lot of this kind of treatment, they'll probably have an old bridge, you know, just knocking around that they can show you. We've got a couple in our cupboard which we give to our patients, and quite often they're surprised at how heavy these things are. But usually once they're fitted, the weight is never actually an issue. So as always, I hope you found this video informative. I hope you learned something. If you did, you know, please give it a thumbs up. Consider subscribing. It helps the channel out, and I will see you soon in our next video. Take care.